Question 1. Governance review demonstrates a need to refine the documentation of patient physiological processes related to how substances enter and leave the body. Which of the following accurately and precisely describes the processes by which a drug moves from the site of administration into the bloodstream and then is removed from the body? Option A. Pharmacokinetics, encompassing absorption and excretion. Option B. The drug's journey from ingestion to waste. Option C. The body's uptake and disposal of a substance. Option D. The chemical breakdown and removal of a compound. Correct answer is A. Pharmacokinetics, encompassing absorption and excretion. Explanation. This scenario is professionally challenging because it requires the accurate and timely application of medical terminology to describe complex physiological processes, specifically absorption and elimination, within the context of patient care. Misinterpreting or misapplying these terms can lead to significant errors in documentation, communication between healthcare providers, and ultimately, patient treatment plans. The pressure to optimize processes, as indicated by the governance review, adds a layer of urgency to ensure precision. The correct approach represents best professional practice because it prioritizes accurate and specific medical terminology, aligning with established standards for medical documentation and communication. This ensures that all members of the healthcare team have a clear and unambiguous understanding of the patient's physiological status. Adherence to these standards is implicitly mandated by professional ethical codes and regulatory frameworks that emphasize patient safety and quality of care, which are underpinned by precise communication. An incorrect approach that focuses on general physiological descriptions rather than specific medical terms for absorption and elimination fails to meet the required level of precision. This can lead to misinterpretation by other healthcare professionals, potentially resulting in incorrect diagnoses or treatment adjustments. Ethically, this constitutes a failure to communicate effectively, which is a cornerstone of patient safety. Another incorrect approach that uses colloquial or imprecise language to describe absorption and elimination processes introduces ambiguity. This ambiguity can obscure critical details about the patient's condition, hindering effective clinical decision-making. Regulatory frameworks often require clear, concise, and accurate medical records, and the use of such language would violate these requirements, potentially leading to documentation errors and compromising patient care. The professional reasoning process for similar situations should involve a systematic approach to terminology selection. Professionals must first identify the specific physiological process being described, e.g., absorption of a medication, elimination of a waste product. Then they should access their knowledge base or consult reliable medical dictionaries and resources to identify the most precise and appropriate medical term. Finally, they should consider the context of the documentation and the intended audience to ensure clarity and avoid misinterpretation, always prioritizing accuracy and adherence to professional standards. Question 2. The control framework reveals a surgeon who, due to deeply held personal religious beliefs, feels ethically conflicted about performing a specific elective surgical procedure that is medically indicated for the patient. The patient has been fully informed of the risks and benefits and has consented to the procedure. The surgeon's refusal to operate would directly impede the patient's access to timely care. What is the most ethically and professionally sound course of action for the surgeon in this situation? Option A. Refuse to perform the procedure and inform the patient that they must seek care elsewhere, offering no further assistance. Option B. Refer the patient to another qualified surgeon who can perform the procedure without personal objection, ensuring continuity of care. Option C. Perform the procedure while expressing personal reservations to the patient, aiming to subtly influence their future decisions. Option D. Delay the referral process until the patient expresses significant distress, hoping they will find an alternative provider independently. The correct answer is B. Refer the patient to another qualified surgeon who can perform the procedure without personal objection, ensuring continuity of care. Explanation. Scenario analysis. This scenario presents a professional challenge due to the conflict between a healthcare provider's personal beliefs and the established standard of care, particularly when it impacts patient autonomy and access to necessary medical procedures. The ethical dilemma arises from the potential for personal values to override professional obligations, which can lead to patient harm or a breach of trust. Careful judgment is required to navigate these competing interests while upholding patient well-being and professional integrity. Correct approach analysis. The correct approach, which involves referring the patient to another qualified provider who can perform the procedure without personal objection, represents best professional practice. This aligns with ethical principles of patient autonomy and beneficence. Ethically, healthcare professionals have a duty to provide or facilitate access to care, even if it conflicts with their personal beliefs. Regulatory frameworks often mandate that providers must not abandon patients and must ensure continuity of care. By referring the patient, the provider respects the patient's right to choose and ensures they receive the necessary surgical intervention, thereby upholding their professional responsibility and adhering to guidelines that prioritize patient welfare over provider personal convictions in such matters. Incorrect approaches analysis. One incorrect approach would be to refuse to perform the procedure and offer no alternative referral, citing personal beliefs. This is a regulatory and ethical failure because it constitutes patient abandonment and violates the principle of beneficence. It denies the patient access to care and places their health at risk, directly contradicting professional obligations. Another incorrect approach would be to perform the procedure while expressing personal disapproval or judgment to the patient. This is ethically unacceptable as it undermines the patient-physician relationship, erodes trust, and can cause significant emotional distress. It also fails to respect patient autonomy by imposing personal values onto their medical decisions. A third incorrect approach would be to delay or obstruct the referral process due to personal discomfort, hoping the patient will seek care elsewhere independently. This is a failure of professional duty and a breach of ethical obligations to facilitate timely access to care. It demonstrates a lack of commitment to the patient's well-being and can lead to negative health outcomes due to delays. Professional reasoning. Professionals facing such dilemmas should first acknowledge the conflict between personal beliefs and professional duties. The decision-making process should prioritize patient needs and rights. This involves understanding relevant professional codes of conduct, ethical guidelines, and legal requirements regarding patient care and referrals. When a conflict arises, the immediate step is to ensure the patient is not disadvantaged. This typically means exploring options for referral to a colleague or institution that can provide the service without ethical conflict for the patient. Open and honest communication with the patient about the referral process, without judgment, is crucial. The focus should always remain on ensuring the patient receives appropriate and timely medical care. Question 3. Compliance review shows a healthcare provider's notes regarding a patient's gynecological examination contain several instances of vague descriptions for anatomical structures within the female reproductive system. Which of the following approaches best ensures accurate and professional medical documentation in this context? Option A. Prioritizing speed of documentation by using general terms that cover a broad range of possibilities. Option B. Relying on abbreviations and shorthand commonly used within the specific clinic, even if not universally recognized. Option C. Using descriptive, everyday language that the patient might easily understand to document findings. Option D. Employing precise, standardized medical terminology for all anatomical structures and physiological processes of the female reproductive system. The correct answer is D. Employing precise, standardized medical terminology for all anatomical structures and physiological processes of the female reproductive system. Explanation. Scenario analysis. This scenario presents a professional challenge in accurately documenting patient care within the reproductive system context. Misinterpreting or incorrectly applying medical terminology can lead to significant communication breakdowns between healthcare providers, potentially impacting diagnosis, treatment, and patient safety. The challenge lies in ensuring precise and standardized language is used, adhering to established medical terminology conventions. Correct approach analysis. The correct approach involves utilizing precise and universally understood medical terminology for anatomical structures and physiological processes of the reproductive system. This ensures clarity, accuracy, and consistency in patient records, facilitating effective communication among healthcare professionals and supporting appropriate medical decision-making. Adherence to established medical terminology is a cornerstone of professional practice, directly impacting the quality and safety of patient care. Incorrect approach is analysis. An approach that relies on colloquial or imprecise language fails to meet professional standards. This can lead to ambiguity, misinterpretation, and errors in documentation, violating ethical obligations to maintain accurate patient records. It undermines the integrity of the medical record and can have serious consequences for patient care. An approach that uses outdated or non-standardized terminology introduces confusion and hinders effective communication. Medical terminology evolves, and staying current with accepted terms is crucial for professional competence and patient safety. Failure to do so can result in misunderstandings and potential medical errors. An approach that prioritizes brevity over accuracy risks omitting critical details or misrepresenting anatomical structures or processes. While efficiency is important, it must not compromise the precision required in medical documentation. Inaccurate or incomplete terminology can lead to diagnostic errors or inappropriate treatment plans. Professional reasoning. Professionals should approach medical documentation with a commitment to accuracy and clarity. This involves a thorough understanding of established medical terminology, including its correct application to anatomical structures and physiological functions of the reproductive system. When in doubt, consulting authoritative medical dictionaries, glossaries, or experienced colleagues is a sound professional practice. The decision-making process should always prioritize patient safety and the integrity of the medical record, ensuring that all documentation is precise, unambiguous, and adheres to professional standards. Question 4. Risk assessment procedures indicate a need to verify understanding of the endocrine system's anatomical structures and their primary hormonal functions. A patient presents with symptoms suggestive of a disorder affecting hormone production. Which of the following accurately describes the anatomical location and primary hormonal product of a key endocrine gland involved in stress response and metabolism? Option A. The thyroid gland, located in the neck, is primarily responsible for producing insulin. Option B. The adrenal cortex, located superior to the kidneys, is primarily responsible for producing cortisol. Option C. The pancreas, located in the abdomen, is primarily responsible for producing adrenaline. Option D. The pituitary gland, located at the base of the brain, is primarily responsible for producing glucagon. Correct answer is B. The adrenal cortex, located superior to the kidneys, is primarily responsible for producing cortisol. Explanation. Scenario analysis. This scenario presents a professional challenge due to the potential for misinterpretation of complex medical terminology related to the endocrine system, which can lead to diagnostic errors or inappropriate treatment. The need for precise anatomical and physiological understanding is paramount, as even subtle distinctions in terminology can signify significant differences in disease processes or hormonal functions. Professionals must exercise careful judgment to ensure accurate communication and patient care. Correct approach analysis. The correct approach involves accurately identifying the anatomical location and physiological function of the adrenal glands and their associated hormones. This demonstrates a deep understanding of the endocrine system, specifically the role of the adrenal cortex in producing cortisol. This aligns with best professional practice by ensuring accurate medical terminology is used, which is fundamental for clear communication between healthcare providers, accurate record keeping, and ultimately, effective patient management. Regulatory frameworks for medical professionals emphasize the importance of accurate documentation and communication, which are directly supported by precise anatomical and physiological knowledge. Incorrect approach is analysis. One incorrect approach would be to confuse the adrenal glands with other endocrine glands, such as the thyroid or pituitary gland. This represents a failure in basic anatomical knowledge and could lead to misdiagnosis or incorrect treatment plans, violating professional standards of care and potentially regulatory requirements for competent practice. Another incorrect approach would be to misidentify the hormones produced by the adrenal cortex, for example, attributing the production of insulin to this gland. This demonstrates a lack of understanding of the specific functions of different endocrine organs and their hormonal outputs. Such an error would be a significant breach of professional competence and could have severe consequences for patient safety, contravening ethical obligations and potentially regulatory mandates for accurate medical knowledge. A further incorrect approach would be to focus solely on the symptoms without understanding the underlying endocrine pathology. While symptom recognition is important, without accurate anatomical and physiological knowledge of the endocrine system, the root cause of the symptoms cannot be correctly identified, leading to ineffective or harmful interventions. This reflects a superficial understanding that falls short of professional expectations and regulatory requirements for evidence-based practice. Professional reasoning. Professionals should employ a systematic decision-making framework that begins with a thorough review of the patient's presentation and relevant medical history. This should be followed by a detailed recall and application of anatomical and physiological knowledge pertaining to the endocrine system. When faced with complex terminology, professionals should consult reliable medical resources to confirm definitions and functions. The process should prioritize accuracy in identifying anatomical structures, their hormonal products, and the physiological consequences of hormonal imbalances. This rigorous approach ensures that all diagnostic and treatment decisions are grounded in sound medical science, adhering to ethical principles and regulatory standards for patient care. Question 5. The risk matrix shows a potential for miscommunication regarding drug dosages and indications due to imprecise use of pharmacological terms. Which approach best mitigates this risk within the established regulatory framework for medical terminology and anatomy? Option A. Memorizing a list of pharmacological terms and their basic definitions without considering their clinical application. Option B. Using outdated medical textbooks and referencing older drug compendiums for information. Option C. Consulting official medical dictionaries, pharmacopoeias, and relevant regulatory guidelines, and actively applying these terms in clinical documentation and communication. Option D. Relying on general online encyclopedias and informal medical forums for definitions and usage examples. The correct answer is C. Consulting official medical dictionaries, pharmacopoeias, and relevant regulatory guidelines, and actively applying these terms in clinical documentation and communication. Explanation. Scenario analysis. This scenario presents a professional challenge due to the critical nature of accurate pharmacological terminology in patient care and medical documentation. Misinterpreting or misusing terms can lead to medication errors, incorrect diagnoses, and compromised patient safety. The professional is tasked with evaluating different approaches to understanding and applying these terms, requiring a deep understanding of their precise meanings and implications within a healthcare context. The challenge lies in discerning the most effective and compliant method for acquiring and utilizing this specialized knowledge. Correct approach analysis. The correct approach emphasizes direct engagement with authoritative sources and practical application within the specified regulatory framework. This involves consulting official medical dictionaries, pharmacopoeias, and regulatory guidelines relevant to medical terminology and anatomy. Furthermore, actively using these terms in clinical documentation and communication, under supervision or with peer review, solidifies understanding and ensures compliance with established standards. This method aligns with best practices by prioritizing accuracy, adherence to regulatory requirements for medical record keeping, and the development of practical competency, all of which are paramount in a healthcare setting governed by specific medical terminology and anatomy regulations. Incorrect approach is analysis. Relying solely on informal online forums or general encyclopedic resources for pharmacological terms is professionally unacceptable. These sources often lack the rigorous vetting and accuracy required for medical contexts, potentially leading to the adoption of imprecise or incorrect terminology. This failure violates the ethical obligation to provide accurate patient care and documentation, and it contravenes regulatory requirements for the use of standardized medical language. Using outdated textbooks or materials without cross-referencing current pharmacopoeias or regulatory updates is also a significant failure. Medical knowledge, including pharmacological terms and their applications, evolves. Outdated information can lead to prescribing errors or misinterpretations of drug actions and indications, posing a direct risk to patient safety and violating the principle of maintaining current professional knowledge mandated by regulatory bodies. Focusing exclusively on memorizing definitions without understanding their clinical context or application is insufficient. While memorization is a component of learning, true professional competence requires the ability to apply pharmacological terms accurately in real-world clinical scenarios, such as charting patient responses to medication or communicating with other healthcare professionals. A purely definitional approach neglects the practical and communicative aspects of medical terminology, which are essential for effective and safe patient care, and are implicitly or explicitly required by regulatory frameworks governing medical practice. Professional reasoning. Professionals should adopt a systematic approach to learning and applying pharmacological terms. This involves 1. Identifying authoritative sources, e.g., official medical dictionaries, pharmacopoeias, regulatory guidelines. 2. Actively seeking to understand the clinical context and application of each term. 3. Practicing the use of these terms in documentation and communication, ideally with feedback mechanisms. 4. Committing to continuous learning and updating knowledge as new information and regulations emerge. This iterative process ensures accuracy, promotes patient safety, and maintains compliance with all relevant professional and regulatory standards. Question 6. Benchmark analysis indicates that healthcare providers often face challenges in accurately describing musculoskeletal conditions. When documenting a patient's complaint of pain in the lower leg after a fall, which approach best reflects precise anatomical and pathological terminology for effective medical record keeping? Option A. Recording the patient's subjective description of pain, such as achy in the shin. Option B. Documenting the specific bone affected and the nature of the injury, such as fracture of the distal tibia. Option C. Describing the sensation as bruised feeling without specifying the anatomical location. Option D. Using a general term like leg pain to encompass the area of discomfort. The correct answer is B. Documenting the specific bone affected and the nature of the injury, such as fracture of the distal tibia. Explanation. Scenario analysis. This scenario presents a professional challenge in accurately documenting patient care within the musculoskeletal system. The challenge lies in the potential for misinterpretation or incomplete documentation of anatomical structures and their associated conditions, which can directly impact diagnosis, treatment planning, and communication among healthcare professionals. Precise medical terminology is paramount for patient safety and effective care coordination. Correct approach analysis. The correct approach involves utilizing precise anatomical and pathological terminology when documenting findings related to the musculoskeletal system. This aligns with the fundamental principles of medical record keeping, which mandate accuracy, clarity, and completeness. For instance, distinguishing between a sprain ligament injury and a strain muscle or tendon injury is critical. Similarly, specifying the exact bone involved in a fracture, e.g., tibia fracture rather than just leg fracture, or the specific joint affected by arthritis, e.g., osteoarthritis of the knee versus joint pain, ensures unambiguous communication and facilitates appropriate clinical decision-making. This adherence to accurate terminology is implicitly required by professional standards of practice and regulatory frameworks governing healthcare documentation, which aim to ensure quality of care and patient safety. Incorrect approaches analysis. Using vague or generalized terms for musculoskeletal conditions is professionally unacceptable. For example, documenting knee problem instead of specifying meniscal tear or ligamentous injury fails to provide sufficient detail for subsequent care. This lack of specificity can lead to diagnostic delays, inappropriate treatments, and potential patient harm. Such documentation also violates the implicit ethical obligation to provide accurate and comprehensive patient records. Furthermore, employing colloquialisms or non-standard terminology, such as pulled muscle instead of muscle strain, compromises professional communication and can introduce ambiguity. This can hinder interdisciplinary collaboration and may lead to errors in coding and billing, potentially impacting reimbursement and regulatory compliance. Professional reasoning. Professionals should approach musculoskeletal documentation by first identifying the specific anatomical structure involved, e.g., bone, joint, muscle, ligament, tendon. Next, they must accurately describe the pathology or condition affecting that structure using precise medical terminology. This involves understanding the nuances between similar-sounding terms and their distinct clinical implications. When in doubt, consulting anatomical atlases, medical dictionaries, or experienced colleagues is a crucial step. The decision-making process should prioritize clarity, accuracy, and completeness to ensure that the medical record serves as a reliable tool for patient care and communication. Question 7. The efficiency study reveals that the documentation of patient conditions in the oncology department is inconsistent. A physician has diagnosed a patient with a malignant neoplasm of the breast. Which of the following diagnostic terms most accurately and specifically reflects this physician's assessment for proper medical record documentation and coding? Option A. malignant neoplasm of the breast. Option B, mass in the breast. Option C, breast lump. Option D, cancer. The correct answer is A, malignant neoplasm of the breast. Explanation: scenario analysis. This scenario presents a challenge in accurately documenting patient care, specifically concerning diagnostic terms. Misinterpreting or misapplying diagnostic terminology can lead to incorrect medical records, impacting patient safety, billing accuracy, and continuity of care. The professional challenge lies in ensuring that the chosen diagnostic term precisely reflects the physician's assessment and is appropriate within the established medical terminology framework. This requires a thorough understanding of anatomical and pathological terms and their correct application in a diagnostic context. Correct approach analysis. The correct approach involves selecting a diagnostic term that accurately and specifically describes the patient's condition as identified by the physician. This aligns with best professional practice by ensuring the medical record is a precise reflection of the clinical encounter. Regulatory frameworks, such as those governing medical record keeping and healthcare billing, e.g., HIPAA in the U.S., which mandates accurate and complete records, implicitly require the use of correct and specific terminology to ensure proper coding, reimbursement, and subsequent patient management. Using a term that is both anatomically and pathologically correct is paramount for clear communication among healthcare providers and for maintaining the integrity of the patient's health information. Incorrect approaches analysis. Using a vague or overly general diagnostic term is professionally unacceptable because it fails to provide sufficient detail for accurate coding, billing, and clinical decision-making. This can lead to misinterpretation by other healthcare professionals, potentially impacting treatment plans. It also violates the implicit regulatory requirement for accurate medical record documentation. Selecting a term that is anatomically incorrect or misrepresents the pathological process is a direct failure in professional competence and a violation of ethical standards for medical record keeping. Such errors can have severe consequences for patient safety and can lead to fraudulent billing practices, which are subject to strict regulatory penalties. Choosing a term that is not a recognized medical diagnosis, even if it describes a symptom, is also problematic. While symptoms are important, a diagnostic term should ideally represent a confirmed or suspected condition, not just a subjective experience, unless the diagnosis itself is symptomatic. This can lead to confusion and misclassification in patient records. Professional reasoning. Professionals should approach diagnostic term selection by first understanding the physician's assessment. They should then consult reliable medical terminology resources and dictionaries to identify the most precise and accurate term. If there is any ambiguity, seeking clarification from the physician is essential. The decision-making process should prioritize accuracy, specificity, and adherence to established medical coding and documentation standards. This ensures that the medical record is a reliable and actionable document, upholding both professional integrity and regulatory compliance. Question 8. Assessment of the correct method for deciphering the meaning of the medical term cardiomyopathy requires understanding the foundational rules of medical term construction. Which of the following accurately applies these rules? Option A, focusing on the myo part as muscle and the pathy part as suffering, and then adding cardio as a general descriptor for a bodily issue. Option B, identifying the root cardi meaning heart, the combining vowel O, and the suffix pathy meaning disease to understand it as a disease of the heart. Option C, inferring that myopathy relates to muscle and cardio relates to the heart, thus it's a heart-muscle disease, without explicitly breaking down the components. Option D, assuming cardio refers to circulation and myopathy refers to a general ailment, leading to a broad interpretation of a circulatory problem. The correct answer is B, identifying the root cardi meaning heart, the combining vowel O, and the suffix pathy meaning disease, to understand it as a disease of the heart. Explanation. This scenario presents a professional challenge because accurate and precise medical terminology is fundamental to effective patient care, communication among healthcare professionals, and proper medical record keeping. Misinterpreting or incorrectly constructing medical terms can lead to diagnostic errors, inappropriate treatment, and potential patient harm. The challenge lies in applying the rules of medical term construction consistently and correctly, especially when faced with unfamiliar or complex terms. The correct approach represents best professional practice because it demonstrates a thorough understanding of the etymology and structural components of medical terms. By breaking down a term into its prefix, root, and suffix, and understanding their individual meanings, one can accurately decipher the overall meaning of the term. This systematic approach ensures that the interpretation is based on established linguistic rules within medical terminology, aligning with the core principles of accurate documentation and communication mandated by professional standards and regulatory bodies overseeing healthcare information. An incorrect approach that relies on guessing or assuming the meaning of a term based on superficial resemblance to other words is professionally unacceptable. This failure constitutes a breach of professional diligence and accuracy. It can lead to miscommunication, incorrect coding for billing and statistical purposes, and ultimately, compromised patient safety. Such an approach disregards the established rules for building medical terms, which are essential for maintaining the integrity of medical records and ensuring clear, unambiguous communication within the healthcare system. Another incorrect approach, such as prioritizing the most common meaning of a word fragment without considering its specific context within a medical term, also leads to professional failure. Medical terminology is precise, and a root or suffix can have slightly different nuances or specific meanings depending on its combination. Failing to account for this contextual specificity can result in a misinterpretation that has significant clinical implications. This demonstrates a lack of deep understanding of the subject matter, which is a failure in professional competency. The professional reasoning process for similar situations should involve a structured, rule-based approach. When encountering a medical term, the professional should first identify its constituent parts, prefix, root, and suffix. Next, they should determine the meaning of each part based on established medical etymology. Finally, they should synthesize these meanings, following the rules of combining these elements to arrive at the correct overall meaning of the term. If uncertainty remains, consulting reliable medical terminology resources or seeking clarification from a supervisor or colleague is the appropriate course of action, rather than making assumptions. Question 9. Comparative studies suggest that understanding the hierarchical levels of organization in the human body is crucial for accurate medical communication. Which of the following sequences correctly illustrates the progression from the simplest to the most complex level of organization in a human? Option A. Tissue, cell, organ, organism, organ system. Option B. Cell, tissue, organ, organ system, organism. Option C. Organ system, organ, tissue, cell, organism. Option D. Organism, organ system, organ, tissue, cell. The correct answer is B. Cell, tissue, organ, organ system, organism. Explanation. The scenario presents a challenge in accurately identifying and communicating the hierarchical structure of the human body, a fundamental concept in medical terminology and anatomy. Misunderstanding or misrepresenting these levels can lead to diagnostic errors, ineffective treatment planning, and communication breakdowns between healthcare professionals. The professional challenge lies in applying precise terminology to describe the progression from simple to complex biological organization. The correct approach represents best professional practice because it accurately reflects the established scientific hierarchy of biological organization. This aligns with the core principles of medical terminology and anatomy, ensuring clear, unambiguous communication essential for patient care and scientific discourse. Adherence to this established hierarchy is implicitly required by the need for standardized and universally understood medical language, which is a cornerstone of safe and effective healthcare delivery. An incorrect approach that misidentifies the order or inclusion of organizational levels demonstrates a failure to grasp fundamental anatomical principles. This can lead to inaccurate documentation, misinterpretation of medical reports, and ultimately, compromised patient safety. Ethically, healthcare professionals have a duty to maintain competence and provide accurate information. Failing to understand basic anatomical organization violates this duty. Regulatory frameworks in healthcare, while not explicitly detailing every anatomical level, mandate accuracy and competence in medical practice, which inherently requires a correct understanding of these foundational concepts. The professional decision-making process for similar situations involves a systematic review of foundational knowledge. When faced with a question about anatomical organization, a professional should recall the established hierarchy. Cells form tissues, tissues form organs, organs form organ systems, and organ systems form the organism. Any deviation from this established order or the inclusion of extraneous concepts would be immediately flagged as incorrect based on this foundational understanding. This process emphasizes the importance of continuous learning and the rigorous application of established scientific principles in medical practice. Question 10. Stakeholder feedback indicates a need to enhance the accuracy of medical documentation related to the urinary system. A healthcare professional is reviewing patient charts and encounters terms describing the flow of urine. Considering the U.S. regulatory framework for medical terminology and anatomy, which of the following approaches best ensures accurate and compliant documentation of urinary system function? Option A. Employing common, everyday language that is easily understood by patients, even if it lacks specific anatomical detail. Option B. Using a combination of general medical terms and personal shorthand to expedite documentation. Option C. Utilizing precise anatomical and physiological terms that specifically describe the origin, pathway, and expulsion of urine, referencing established U.S. medical terminology resources. Option D. Focusing on the subjective experience of the patient regarding urination, without detailing the underlying anatomical processes. The correct answer is C. Utilizing precise anatomical and physiological terms that specifically describe the origin, pathway, and expulsion of urine, referencing established U.S. medical terminology resources. Explanation. This scenario presents a professional challenge due to the critical nature of accurate medical terminology in patient care and documentation within the U.S. regulatory framework governing healthcare. Misinterpreting or misapplying terms related to the urinary system can lead to diagnostic errors, inappropriate treatment, and ultimately, patient harm. The need for precise communication between healthcare professionals, accurate record-keeping for billing and legal purposes, and adherence to standards set by bodies like HIPAA, Health Insurance Portability and Accountability Act, and CMS, Centers for Medicare and Medicaid Services, necessitates a deep understanding of anatomical and medical terminology. The correct approach represents best professional practice because it directly addresses the core requirement of accurate medical terminology as mandated by U.S. healthcare regulations. This ensures that patient records are precise, facilitating effective communication among the care team, supporting accurate coding for reimbursement, governed by CMS guidelines, and maintaining compliance with data privacy and security standards, HIPAA. A thorough understanding of the urinary system's anatomy and associated terminology is fundamental to providing safe and effective patient care, which is an ethical and regulatory imperative. An incorrect approach that relies on colloquial or imprecise language fails to meet the professional standards of medical documentation. This can lead to ambiguity, misinterpretation by other healthcare providers, and potential coding errors, violating CMS requirements for accurate billing. Furthermore, it risks compromising patient confidentiality and data integrity, which are central to HIPAA. Another incorrect approach that focuses solely on a superficial understanding without delving into the specific anatomical structures and their functions would be insufficient. This would not equip a professional to accurately document conditions or procedures, leading to potential miscommunication and diagnostic or treatment errors, which are contrary to the ethical duty of care and regulatory expectations for competent practice. The professional decision-making process for similar situations should involve a systematic approach. First, identify the specific medical context and the required level of detail. Second, consult reliable, jurisdiction-specific resources, e.g., established medical dictionaries, anatomy textbooks aligned with U.S. standards, professional guidelines, to ensure accurate terminology. Third, consider the audience and purpose of the communication or documentation to ensure clarity and precision. Finally, always prioritize patient safety and regulatory compliance in all aspects of medical terminology application. Question 11. To address the challenge of accurately identifying and describing anatomical structures from a visual representation, which approach best aligns with the foundational requirements for proficiency in medical terminology and anatomy as mandated by professional standards and educational frameworks? Option A. Guessing the identity of unfamiliar structures based on their perceived shape and location without further verification. Option B. Relying on general knowledge of the human body and using commonly understood terms to describe the visible parts. Option C. Prioritizing speed of identification to complete the task efficiently, even if some structures are described with less certainty. Option D. consulting authoritative anatomical atlases and textbooks to confirm precise identification and utilize standardized medical terminology for each structure. The correct answer is B, relying on general knowledge of the human body and using commonly understood terms to describe the visible parts. Explanation. Scenario analysis. The scenario presents a challenge for a medical terminology student who is tasked with accurately identifying and describing anatomical structures based on a provided image. This is professionally challenging because misidentification or inaccurate description of anatomical parts can lead to significant communication breakdowns between healthcare professionals, potentially impacting patient care, diagnosis, and treatment planning. The ability to precisely use anatomical terminology is a foundational skill, and errors here can have cascading negative consequences in a clinical setting. Correct approach analysis. The correct approach involves meticulously comparing the visual information in the image with established anatomical knowledge and referencing reliable anatomical atlases or textbooks. This aligns with the core principles of medical education and professional practice, which mandate accuracy and precision in anatomical identification. Regulatory frameworks for medical education and practice emphasize the importance of a strong foundational understanding of anatomy and the correct use of terminology to ensure patient safety and effective communication within the healthcare team. Adhering to these standards is a direct reflection of professional competence and ethical responsibility. Incorrect approach is analysis. One incorrect approach involves relying solely on guesswork or superficial resemblance to known structures without rigorous verification. This fails to meet the fundamental requirement for accuracy in medical terminology and anatomy, potentially leading to the propagation of misinformation. Ethically, this demonstrates a lack of diligence and a disregard for the importance of precise knowledge in a healthcare context. Another incorrect approach is to use colloquial or non-standard terms for anatomical structures. This violates the established conventions of medical communication, which rely on a standardized, universally understood lexicon. Such a failure can lead to confusion and misinterpretation among healthcare providers, directly impacting patient care and violating professional standards of clear communication. A third incorrect approach might involve prioritizing speed over accuracy, rushing through the identification process without proper attention to detail. This is a direct contravention of professional best practices, which always place accuracy and thoroughness above expediency when dealing with critical medical information. Regulatory bodies and professional organizations consistently stress the need for meticulousness in anatomical identification and terminology. Professional reasoning. Professionals facing such a task should employ a systematic approach. First, thoroughly examine the provided image, noting key features and relationships of the structures. Second, consult authoritative anatomical resources, e.g., Gray's Anatomy, Netter's Atlas of Human Anatomy, to confirm identification and terminology. Third, articulate the anatomical description using precise, standardized medical terminology. Finally, if any doubt persists, seek clarification from a qualified instructor or supervisor. This methodical process ensures accuracy, upholds professional standards, and minimizes the risk of errors that could compromise patient safety. Question 12. The performance metrics show a consistent pattern of misidentification of the anatomical location of a patient's pain when charting. A new nurse is documenting a patient's complaint of discomfort in the upper right quadrant of the abdomen. Which of the following terms accurately and precisely describes this anatomical region according to standard medical terminology? Option A, upper right belly area. Option B, right upper quadrant. Option C, right side upper stomach region. Option D, top right abdominal zone. The correct answer is B, right upper quadrant. Explanation. This scenario is professionally challenging because it requires the accurate and precise communication of anatomical information within a healthcare setting, where misinterpretation can lead to significant patient harm. The use of correct anatomical terminology is paramount for ensuring that all members of the healthcare team understand the patient's condition and the proposed interventions. The regulatory framework for medical terminology and anatomy, as tested in this exam, emphasizes the importance of standardized language to prevent errors and ensure patient safety. The correct approach represents best professional practice because it demonstrates a thorough understanding and application of established anatomical terminology. This adherence to standardized language ensures clarity, reduces ambiguity, and facilitates effective communication among healthcare professionals. It directly aligns with the ethical obligation to provide competent care and the regulatory requirement to maintain accurate patient records. Using precise anatomical terms is a fundamental aspect of professional competence in healthcare. An incorrect approach that relies on colloquial or imprecise language fails to meet professional standards. This can lead to misdiagnosis, incorrect treatment, or unnecessary procedures, all of which violate ethical principles of non-maleficence and beneficence. From a regulatory standpoint, such imprecise communication can result in documentation errors, which are subject to scrutiny and can have legal ramifications. Another incorrect approach might involve using terms that are technically correct but not universally understood or are specific to a particular subspecialty without proper context. This can create confusion for other members of the healthcare team who may not share that specialized knowledge, thereby compromising interdisciplinary communication and patient care. This highlights the need for a common, standardized lexicon. The professional decision-making process for similar situations should involve a commitment to continuous learning and a rigorous adherence to established medical terminology. When in doubt, professionals should consult authoritative anatomical dictionaries, glossaries, or senior colleagues to ensure accuracy. The priority must always be clear, unambiguous, and correct communication to safeguard patient well-being and comply with professional and regulatory expectations. Question 13. Quality control measures reveal a discrepancy in the descriptive notes for a patient's limb injury. One note states the swelling is towards the shoulder, while another indicates it is superior to the elbow. Considering the standard anatomical position and directional terms, which of the following interpretations most accurately reflects the intended meaning and adheres to best practices in medical documentation? Option A. The swelling is located on the chest near the shoulder. Option B. The swelling is located on the forearm closer to the elbow joint than the wrist. Option C. The swelling is located on the upper arm, closer to the shoulder joint than the elbow joint. Option D. The swelling is located on the thigh, closer to the hip joint than the knee joint. The correct answer is C. The swelling is located on the upper arm, closer to the shoulder joint than the elbow joint. Explanation. Scenario analysis. This scenario presents a challenge in accurately and unambiguously communicating patient positioning and anatomical relationships. In medical terminology and anatomy, precision is paramount. Misinterpreting or misapplying directional terms can lead to significant errors in documentation, diagnostic imaging interpretation, surgical planning, and patient care. The professional challenge lies in ensuring that all healthcare professionals involved in a patient's care understand and use these terms consistently and correctly, adhering to established anatomical conventions. Correct approach analysis. The correct approach involves a thorough understanding and application of the standard anatomical position and universally accepted directional terms. The anatomical position serves as the reference point for describing body parts and their relative locations. Directional terms, e.g., superior, inferior, anterior, posterior, medial, lateral, proximal, distal, provide a standardized language for describing spatial relationships. Using these terms accurately ensures clear, objective, and consistent communication, which is a cornerstone of safe and effective patient care, and aligns with the ethical imperative to provide competent medical services. Adherence to these established terminologies is implicitly required by the standards of practice within medical terminology and anatomy education and practice. Incorrect approaches analysis. One incorrect approach would be to rely on subjective or colloquial descriptions of body parts or their positions. This fails to meet the requirement for objective and standardized communication, leading to potential ambiguity and misinterpretation. Such an approach lacks the precision necessary for medical documentation and can be considered a failure in professional competence. Another incorrect approach would be to use directional terms inconsistently or in a manner that contradicts their established anatomical definitions. For example, using up or down without reference to the anatomical position, or confusing anterior with posterior. This directly violates the principles of medical terminology and can lead to critical errors in understanding anatomical relationships, potentially impacting diagnosis and treatment. This represents a failure to adhere to the fundamental knowledge base expected of professionals in this field. A further incorrect approach would be to assume that a patient's current, non-standardized position, G, lying on their side, is the reference point for directional terms without explicitly stating the deviation from the anatomical position. This introduces confusion and makes it difficult for others to visualize the patient's anatomy accurately. It demonstrates a lack of understanding of the importance of a consistent reference point in anatomical description. Professional reasoning. Professionals should approach anatomical descriptions by first establishing the reference point, the anatomical position. They should then systematically apply the appropriate directional terms to describe the location of structures relative to this position and to each other. When a patient is not in the anatomical position, this deviation should be clearly stated, and directional terms should be used with careful consideration of the altered orientation, or relative to specific body landmarks if ambiguity persists. Regular review of anatomical terminology and practice in applying directional terms are essential for maintaining competence. Question 14. The performance metrics show a consistent need for improved understanding of fundamental cellular structures and their roles within the human body. Considering the diverse array of specialized cells, which of the following best categorizes and differentiates key cell types based on their primary functions and anatomical locations? Option A. Neurons, responsible for transmitting electrochemical signals; erythrocytes, responsible for oxygen transport; and myocytes, responsible for contraction. Option B. Cells are broadly classified as either prokaryotic or eukaryotic, with no further functional distinctions necessary for medical terminology. Option C. Cells are categorized by their color and size, with all cells within a tissue sharing identical functions. Option D. Cells are primarily differentiated by their ability to divide, with all cell division rates being uniform across all human tissues. The correct answer is A. Neurons, responsible for transmitting electrochemical signals; erythrocytes, responsible for oxygen transport; and myocytes, responsible for contraction. Explanation. Scenario analysis. This scenario presents a professional challenge in a medical terminology and anatomy context where accurate identification and classification of cellular types are paramount for effective patient care and communication within the healthcare team. Misidentification or misclassification of cell types can lead to diagnostic errors, inappropriate treatment plans, and a breakdown in interdisciplinary communication, all of which carry significant professional and ethical implications. The challenge lies in ensuring that the knowledge applied is not only factually correct, but also aligns with the established regulatory framework governing medical practice and terminology, which emphasizes precision and adherence to standardized nomenclature. Correct approach analysis. The correct approach represents best professional practice because it directly addresses the core requirement of the exam, demonstrating a comprehensive understanding of the types of cells in the human body, specifically focusing on their distinct characteristics and functions. This approach ensures that the individual can accurately identify and differentiate between various cell types, such as neurons, erythrocytes, and myocytes, based on their unique anatomical and physiological attributes. This aligns with regulatory expectations for medical professionals to possess foundational knowledge that underpins all aspects of healthcare, from diagnosis to treatment. Adherence to standardized terminology and classification is a cornerstone of patient safety and effective healthcare delivery, as mandated by professional bodies and regulatory agencies that oversee medical education and practice. Incorrect approach is analysis. An incorrect approach that relies solely on a superficial understanding of cell shapes without considering their specific functions or origins would be professionally unacceptable. This fails to meet the regulatory requirement for a deep, functional understanding of anatomy and physiology, which is essential for accurate medical terminology. Such an approach could lead to misinterpretations in diagnostic reports or patient charting, potentially impacting treatment decisions. Another incorrect approach that conflates cells from different organ systems without acknowledging their specialized roles would also be a significant regulatory and ethical failure. Medical terminology and anatomy are built upon precise classification. Failing to differentiate between, for example, a muscle cell and a bone cell demonstrates a fundamental lack of understanding that compromises professional competence and patient safety. This violates the ethical obligation to provide competent care and the regulatory expectation of maintaining up-to-date and accurate knowledge. A third incorrect approach that prioritizes memorization of obscure cell names over understanding their fundamental types and functions would be professionally detrimental. While specific terminology is important, The underlying conceptual understanding of cell classification and function is the bedrock of medical knowledge. Without this foundation, the ability to apply terminology in a clinical context is severely limited, leading to potential errors in communication and diagnosis, which are direct violations of professional standards and regulatory oversight. Professional reasoning. Professionals should approach questions related to medical terminology and anatomy by first identifying the core concept being tested. In this case, it is the classification and understanding of human cell types. The decision-making process should involve recalling and applying knowledge of the distinct characteristics, functions, and origins of various cell types. This requires a systematic approach, moving from broad categories to specific examples, and ensuring that the terminology used is accurate and contextually appropriate. Professionals must constantly refer to established anatomical and physiological principles, recognizing that their knowledge directly impacts patient outcomes and their adherence to regulatory and ethical standards. When faced with uncertainty, seeking clarification from authoritative sources or experienced colleagues is a critical step in maintaining professional integrity and ensuring accurate application of knowledge. Question 15. Consider a scenario where a medical transcriptionist receives a dictated note that includes the term cholecystitis. The transcriptionist is unsure if the dictation refers to inflammation of the gallbladder or the appendix. What is the most appropriate action to ensure accuracy and patient safety? Option A. Assume the dictation refers to the gallbladder, as chole commonly relates to the gallbladder. Option B. Consult a medical dictionary or anatomical atlas to confirm the definition of cholecystitis and its anatomical association. Option C. Ask the dictating physician for clarification on the term cholecystitis to avoid any potential misinterpretation. Option D. Transcribe the term phonetically as heard without attempting to define it to avoid introducing errors. The correct answer is A. Assume the dictation refers to the gallbladder, as chole commonly relates to the gallbladder. Explanation. This scenario presents a professional challenge due to the critical need for accurate and precise communication in a healthcare setting. Misinterpreting or misusing medical terminology can lead to significant patient harm, including incorrect diagnoses, inappropriate treatments, and medication errors. The impact assessment here focuses on the potential consequences of communication breakdown stemming from a lack of understanding of common medical terms. The correct approach represents best professional practice because it prioritizes patient safety and adherence to established medical communication standards. In the context of medical terminology and anatomy, this means demonstrating a thorough understanding of root words, prefixes, suffixes, and anatomical structures to correctly interpret and utilize medical terms. This aligns with the ethical obligation to provide competent care and the regulatory expectation for healthcare professionals to maintain accurate patient records and communicate effectively with other members of the healthcare team. An incorrect approach that relies on assumptions or incomplete understanding of medical terms is professionally unacceptable. Such an approach fails to meet the standard of care expected of healthcare professionals. Specifically, it can lead to regulatory violations related to patient safety and quality of care. Ethically, it breaches the duty of beneficence, acting in the patient's best interest, and non-maleficence, avoiding harm. For instance, misinterpreting dyspnea as dizziness could lead to a delayed or incorrect respiratory assessment, potentially causing severe respiratory distress to go unnoticed. Similarly, confusing nephritis, kidney inflammation with neuritis, nerve inflammation, could result in the wrong organ system being targeted for treatment. The professional decision-making process for similar situations should involve a systematic approach to understanding medical terminology. This includes 1. Actively seeking clarification when unsure of a term's meaning. 2. Utilizing reliable medical dictionaries and resources. 3. Practicing the breakdown of terms into their component parts, root, prefix, suffix, to deduce meaning. 4. Engaging in continuous learning and professional development to stay current with medical vocabulary. 5. Prioritizing patient safety above all else, recognizing that clear and accurate communication is a cornerstone of effective healthcare delivery. Question 16. The investigation demonstrates a healthcare provider preparing a summary of a patient's condition for a family member who has limited medical knowledge. The provider is faced with the decision of how to best communicate complex anatomical and physiological information related to the patient's cardiovascular system. The provider considers using highly technical medical terms, simplifying them with everyday language, or omitting certain details to avoid confusion. Option A. Omit detailed descriptions of specific anatomical structures and physiological processes to prevent overwhelming the family member with information. Option B. Employ analogies that are loosely related to the cardiovascular system, focusing on creating a general sense of the patient's condition rather than specific accuracy. Option C. Replace all technical medical terms with colloquial equivalents, even if these terms are less precise or potentially misleading. Option D. Prioritize the use of precise anatomical and physiological terminology, providing clear, concise explanations of each term as needed to ensure understanding. The correct answer is D. Prioritize the use of precise anatomical and physiological terminology, providing clear, concise explanations of each term as needed to ensure understanding. Explanation. Scenario analysis. This scenario presents a professional challenge due to the inherent conflict between a healthcare provider's duty to accurately document patient care and the potential for misinterpretation or misuse of medical terminology by non-medical personnel. The pressure to simplify complex anatomical and physiological terms for a lay audience, while maintaining accuracy and professional integrity, requires careful judgment. The ethical dilemma arises from balancing the need for clear communication with the risk of oversimplification, leading to misunderstanding or even harm if the information is acted upon without proper medical context. Correct approach analysis. The correct approach prioritizes accurate and precise medical terminology, even when communicating with a non-medical audience. This aligns with the fundamental ethical principle of veracity in healthcare and the professional responsibility to maintain the integrity of medical records and communication. Using precise anatomical and physiological terms, while potentially requiring further explanation, ensures that the information conveyed is scientifically sound and avoids the introduction of ambiguity or misinformation. This approach upholds professional standards and minimizes the risk of misinterpretation that could have negative consequences for patient understanding or subsequent medical decisions. It respects the complexity of the subject matter and the importance of accurate representation. Incorrect approaches analysis. One incorrect approach involves the wholesale replacement of accurate medical terms with colloquial or simplified language that lacks precision. This fails to uphold the professional standard of accurate documentation and communication. It risks introducing ambiguity and can lead to a misunderstanding of the underlying anatomical structures or physiological processes, potentially causing confusion or leading to incorrect assumptions about a patient's condition. This approach prioritizes perceived ease of understanding over accuracy, which is a significant ethical and professional failing. Another incorrect approach is the omission of crucial anatomical or physiological details to make the explanation seem simpler. This can lead to an incomplete or misleading picture of the patient's situation. Medical terminology is designed to convey specific information efficiently and accurately. Removing these details, even with good intentions, can obscure the severity or nature of a condition, hindering proper understanding and potentially impacting future care decisions. This approach compromises the depth and accuracy required for effective medical communication. A third incorrect approach is the use of analogies that are not directly representative of the anatomical or physiological concept being explained. While analogies can be helpful, if they are imprecise or misleading, they can create a false understanding. This can be more detrimental than not using an analogy at all, as it can lead to deeply ingrained misconceptions about the body systems. The professional responsibility is to ensure that any simplification aids understanding without distorting the fundamental truth of the medical information. Professional reasoning. Professionals facing such communication challenges should employ a decision-making process that begins with identifying the core medical information that needs to be conveyed. They should then consider the audience's level of understanding and the purpose of the communication. The primary goal should always be to maintain accuracy and integrity. When simplification is necessary, it should be achieved through clear, concise explanations of the precise medical terms, rather than their outright replacement with imprecise language. Professionals should be prepared to offer further clarification and context to ensure comprehension without sacrificing accuracy. This involves a commitment to ongoing education and the development of effective communication strategies that bridge the gap between medical expertise and lay understanding. Question 17. Upon reviewing a patient's chart detailing a procedure involving the removal of a specific section of the small intestine due to a cancerous growth, which of the following terms most accurately and precisely describes the anatomical structure involved, adhering strictly to the established medical terminology for the digestive system? Option A, ileum. Option B, intestine. Option C, gut. Option D, bowel. The correct answer is A, ileum. Explanation. This scenario presents a professional challenge due to the inherent complexity of medical terminology and the potential for misinterpretation, which can have serious consequences for patient care and regulatory compliance. Accurate and precise communication is paramount in healthcare, especially when dealing with the digestive system, where a multitude of organs, processes, and conditions exist. The challenge lies in ensuring that all stakeholders, from healthcare providers to patients, understand the correct terminology to avoid diagnostic errors, inappropriate treatments, and potential legal or ethical breaches. The correct approach represents best professional practice because it prioritizes accuracy, clarity, and adherence to established medical terminology. By focusing on the precise anatomical and physiological terms related to the digestive system, it ensures that communication is unambiguous and scientifically sound. This aligns with the ethical obligation to provide competent care and the regulatory requirement for accurate medical record keeping. Using precise terminology minimizes the risk of miscommunication, which is crucial for effective diagnosis, treatment planning, and interdisciplinary collaboration. An incorrect approach that relies on vague or colloquial terms for digestive system components fails to meet professional standards. This can lead to confusion, misdiagnosis, and potentially harmful treatment decisions. For instance, referring to the food pipe instead of the esophagus or the gullet instead of the pharynx can obscure critical details about the location and function of these structures, hindering accurate assessment and treatment. Such imprecision can also violate regulatory guidelines that mandate clear and accurate medical documentation, potentially leading to audits, penalties, or even loss of licensure. Another incorrect approach might involve using overly simplistic or generalized terms that do not convey the specific nature of a digestive issue. For example, broadly stating stomach problems without specifying the nature of the problem, e.g., gastritis, ulcer, obstruction, prevents targeted intervention and accurate record keeping. This lack of specificity can lead to delays in diagnosis and treatment, negatively impacting patient outcomes and potentially violating standards of care. The professional decision-making process for similar situations should involve a commitment to continuous learning and a rigorous application of established medical terminology. Professionals must actively seek to understand and utilize the correct terms for anatomical structures, physiological processes, and pathological conditions of the digestive system. When in doubt, consulting reliable medical dictionaries, textbooks, or senior colleagues is essential. Furthermore, professionals should be mindful of the audience and adapt their communication style while maintaining accuracy, ensuring that complex medical terms are explained clearly when necessary, particularly when communicating with patients or non-medical personnel. This balanced approach upholds both professional competence and ethical patient communication. Question 18. System analysis indicates that a patient diagnosed with a specific autoimmune disorder has a condition directly impacting the function of their T lymphocytes. When explaining this to the patient, which approach best facilitates understanding and informed consent regarding their treatment plan? Option A. Detail the intricate molecular pathways involved in T lymphocyte activation and cytokine signaling that are dysregulated in their condition. Option B. Explain that their T lymphocytes, a type of white blood cell crucial for immune response, are malfunctioning and attacking healthy tissues, leading to their symptoms, and that the treatment aims to modulate this specific immune cell activity. Option C. State that their T cells are not working correctly and the medication will fix them. Option D. Inform the patient that their immune system is overactive and the medication will suppress it generally. Correct answer is B. Explain that their T lymphocytes, a type of white blood cell crucial for immune response, are malfunctioning and attacking healthy tissues, leading to their symptoms, and that the treatment aims to modulate this specific immune cell activity. Explanation. Scenario analysis. This scenario presents a challenge in accurately and efficiently communicating complex cellular information to a patient. The professional must balance the need for precise medical terminology with the patient's understanding, ensuring informed consent and adherence to treatment plans. Miscommunication can lead to patient anxiety, noncompliance, and potentially adverse health outcomes. The challenge lies in translating intricate biological processes into accessible language without sacrificing accuracy. Correct approach analysis. The correct approach involves using clear, concise language that explains the function of the specific cellular component in relation to the patient's condition. This aligns with ethical principles of patient autonomy and informed consent, as mandated by general healthcare professional guidelines that emphasize patient education and understanding. By relating the cell's function to the disease process, the professional empowers the patient to grasp the rationale behind their treatment, fostering trust and improving adherence. This approach prioritizes patient comprehension and engagement. Incorrect approach is analysis. One incorrect approach is to solely use highly technical medical jargon without any simplification. This fails to meet the ethical obligation to ensure patient understanding, potentially violating principles of informed consent and patient rights to accessible health information. It creates a barrier to communication and can lead to patient confusion and distress. Another incorrect approach is to oversimplify to the point of inaccuracy, omitting crucial details about the cellular function. While aiming for clarity, this can mislead the patient about the nature of their condition or the mechanism of their treatment, undermining the foundation of informed decision-making and potentially leading to misunderstandings about prognosis or treatment efficacy. This compromises the professional's duty of care. A third incorrect approach is to avoid explaining the cellular function altogether, focusing only on the treatment. This neglects the opportunity to educate the patient about the underlying pathology, which is essential for building trust and enabling the patient to actively participate in their healthcare journey. It can leave the patient feeling disempowered and less invested in their recovery. Professional reasoning. Professionals should adopt a patient-centered communication strategy. This involves first assessing the patient's existing knowledge base and then tailoring the explanation accordingly. Employing analogies, visual aids, and opportunities for the patient to ask questions are crucial. The decision-making process should prioritize clarity, accuracy, and empathy, ensuring that the patient feels respected, informed, and capable of making decisions about their health. This aligns with the overarching ethical framework of beneficence and non-maleficence, ensuring that the patient's well-being is paramount. Question 19. Examination of the data shows a microscopic slide revealing a tissue sample with cells that are flattened and arranged in a single layer. These cells are tightly packed, forming a smooth lining. Based on these observed characteristics, which classification of epithelial tissue is most accurately represented? Option A, pseudostratified columnar epithelium. Option B, simple squamous epithelium. Option C, transitional epithelium. Option D, stratified cuboidal epithelium. Correct answer is B, simple squamous epithelium. Explanation. This scenario presents a professional challenge due to the need for precise and accurate medical terminology when documenting patient conditions, particularly concerning the microscopic structure of tissues. Misidentification of epithelial tissue types can lead to incorrect diagnoses, inappropriate treatment plans, and flawed research outcomes. The professional's responsibility is to apply their knowledge of anatomical and histological classifications rigorously. The correct approach represents best professional practice because it demonstrates a thorough understanding of the specific characteristics that differentiate various types of epithelial tissue. This accuracy is paramount for clear communication within the healthcare team and for maintaining comprehensive and reliable patient records, aligning with professional standards of care and the ethical obligation to provide accurate information. An incorrect approach that misclassifies epithelial tissue fails to meet professional standards. This could stem from a lack of detailed knowledge or a failure to apply that knowledge correctly. Such an error could lead to miscommunication, potentially resulting in diagnostic errors or ineffective treatment, which violates the ethical principle of non-maleficence, do no harm. Furthermore, inaccurate documentation can compromise the integrity of medical records, which is a regulatory requirement in most healthcare systems. The professional decision-making process in such situations involves a systematic review of the observed histological features, comparing them against established definitions and classifications of epithelial tissues. This includes considering cell shape, arrangement, number of layers, and the presence of specialized structures like cilia or keratin. When in doubt, consulting with a more experienced colleague or referring to authoritative anatomical and histological texts is a crucial step in ensuring accuracy and upholding professional integrity. Question 20. Performance analysis shows that a new medical coder is struggling to accurately interpret complex anatomical terms. When presented with the term cardiomyopathy, the coder attempts to decipher its meaning. Which of the following approaches demonstrates the most effective and professionally sound method for understanding this term? Option A. Look up cardiomyopathy in a medical dictionary and use the provided definition without attempting to understand the etymological breakdown. Option B. Infer the meaning based on the similarity of cardio to cardiac and pathy to pathology, assuming it relates to heart issues. Option C. Focus solely on the suffix pathy, recognizing it as disease, and assume the rest of the term describes a specific type of disease without further analysis. Option D. Deconstruct the term into its constituent parts, cardio, heart, myo, muscle, and pathy, disease, and synthesize their meanings to understand it as a disease of the heart muscle. The correct answer is D. Deconstruct the term into its constituent parts, cardio, heart, myo, muscle, and pathy, disease, and synthesize their meanings to understand it as a disease of the heart muscle. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a medical terminology professional to accurately interpret and apply complex anatomical terms derived from Latin and Greek roots, prefixes, and suffixes in a clinical context. Misinterpreting these components can lead to significant errors in documentation, communication with healthcare providers, and ultimately, patient care. The pressure to be precise and efficient in a healthcare setting amplifies the need for deep understanding beyond rote memorization. Correct approach analysis. The correct approach involves a systematic deconstruction of the medical term, identifying each word root, prefix, and suffix, and understanding their individual meanings. This method allows for a comprehensive and accurate interpretation of the term's overall meaning, ensuring that the professional can correctly document the patient's condition or procedure. This aligns with the ethical obligation to provide accurate and reliable medical information, which is foundational to patient safety and effective healthcare delivery. Regulatory frameworks for medical documentation emphasize accuracy and clarity, which are directly supported by a thorough understanding of medical terminology's building blocks. Incorrect approaches analysis. One incorrect approach involves guessing the meaning of the term based on its sound or a superficial resemblance to common words. This is ethically unacceptable as it introduces a high risk of error, potentially leading to miscommunication and incorrect treatment plans. It violates the professional duty of care and the regulatory requirement for accurate medical records. Another incorrect approach is to focus only on a single component of the term, such as the prefix or suffix, without considering the word root. This leads to an incomplete and potentially misleading understanding of the term. It demonstrates a lack of thoroughness and can result in significant inaccuracies in documentation, which is a direct contravention of professional standards and regulatory expectations for precision in medical communication. A third incorrect approach is to rely solely on a glossary or dictionary lookup without understanding the underlying etymology. While a dictionary is a useful tool, it does not replace the critical thinking required to dissect and understand how the components of a word contribute to its meaning. This superficial reliance can lead to misapplication of the term in different clinical contexts, undermining the professional's ability to provide accurate and nuanced medical information, thereby failing to meet professional and regulatory standards for comprehensive understanding. Professional reasoning. Professionals should employ a structured approach to medical terminology. This involves 1. Identifying the word root, which typically denotes the body part or condition. 2. Analyzing any prefixes which modify the meaning of the root by indicating location, time, or negation. 3. Examining suffixes which often describe a procedure, disease, or condition. 4. Synthesizing the meanings of these components to arrive at the complete and accurate definition of the medical term. This systematic process ensures accuracy, clarity, and adherence to professional and regulatory standards for medical documentation and communication.